Okay, so let's dive into something that I think we can all relate to. Medical expenses and insurance.
Yeah.
It can be so confusing
Oh, yeah, absolutely.
and honestly kind of scary sometimes.
It is. It is a big black box for a lot of people.
So today we're going to try to demystify it at least a little bit. We're using this awesome guide, Medical Expense Insurance,
Hmm.
to kind of walk us through it. And hopefully by the end of this deep dive, you'll feel a little bit more empowered to make good decisions about your health care and your money.
Yeah, that's the goal.
All right, so let's start with the basics. The guide breaks down a few different types of coverage.
Okay.
First, you have these hospital expense policies.
Right.
I mean, the name kind of says it all. Right?
Yeah, it's pretty self-explanatory.
Covers you if you have to stay in the hospital. Then there's basic surgical and physician expense coverage.
Mm-hmm.
Again, pretty straightforward. This is for surgeries and doctor's visits.
Pretty much.
But then it gets a little more complicated when we get into major medical.
Yeah, major medical is where a lot of the nuances and kind of ins and outs and things that people get tripped up on come into play.
Yeah, and I think that's where most people probably tune out too, right?
Absolutely.
So let's try to break that down.
Yeah.
Now, within major medical, there are two main types, right?
Right. So you've got supplemental major medical and comprehensive major medical.
Yeah.
And sometimes the names can kind of trip people up.
So is it kind of like supplemental is like the sidekick and comprehensive is the main hero?
You could think about it that way. Yeah, supplemental is there to kind of back you up if your basic coverage runs out.
Okay,
So it supplements, it adds to it.
I got it.
Comprehensive, on the other hand, is more like your full coverage from the get-go.
Okay, so comprehensive is kind of like the whole package.
Yes, like the all-in-one.
Okay, so then why would anyone ever choose a supplemental plan over a comprehensive one?
That's a great question. So sometimes it comes down to cost. Supplemental plans can be a little bit less expensive, particularly if you already have some basic coverage, maybe through your employer.
Right.
You might just want something to fill in the gaps, and that's where a supplemental plan can be a good option.
So you're kind of customizing your coverage a little
Yeah,
bit. Okay, that makes sense.
Yeah.
Now, within these major medical policies, there's this thing called coinsurance,
Yes.
which always makes me think of like co-piloting a plane.
Right.
But it's not quite that exciting.
Not quite as adventurous.
So what is coinsurance?
So coinsurance is basically you're sharing the cost of your medical bills with the insurance company.
Right.
So let's say, for example, you have a 20% coinsurance
Mm-hmm.
and you have a medical bill for $1,000.
Okay.
Your insurance company will cover 80% of that, which would be $800.
Okay.
And then you would be responsible for the remaining 20%, which is $200.
Okay, so you're kind of splitting the bill with your insurance company.
You got it. That's a good way to think about it.
And that's where those things like stop loss and out-of-pocket maximum come in.
Right. Yes, exactly. These are really important features to pay attention to because they're kind of like your safety net.
Yeah, they sound kind of like cheat codes. Like if you know these, you can kind of win the game.
They can definitely make a big difference in terms of how much you end up paying out of pocket.
So explain those to me. What are they?
All right, so your stop loss limit is the absolute maximum amount of money that you will pay for covered medical expenses in a year.
Okay.
So once you hit that limit, your insurance company will pick up 100% of the cost for any eligible expenses.
So let's say my stop loss is $5,000
Okay.
and I have a really, really bad year medically.
Hmm.
And my bills end up being like $10,000.
Okay.
I only have to pay $5,000.
That's right. You've hit your stop loss. The insurance company takes over from there.
That's pretty amazing.
Yeah, it's a huge protection against catastrophic medical expenses.
Okay, and what about out-of-pocket maximum? How is that different?
So your out-of-pocket maximum is similar to the stop loss, but it includes other expenses like your deductible and any copays that you've made throughout the year. So it's basically the total amount that you could possibly spend out of pocket.
So that's a really important number to know.
It is, absolutely. It helps you plan for the worst case scenario.
All right, so we've talked about the basic types of coverage and these kind of key features within major medical.
Mm-hmm.
Now, this guide also mentions the Affordable Care Act,
Right.
or ACA, as a lot of people call it.
Yeah.
And this seems like it's kind of a game changer in the insurance world.
It was a huge shift when it was introduced. I mean, it changed a lot of things about how health insurance works.
So tell me about some of the key things that it did.
One of the biggest changes was the introduction of the health insurance exchange,
Okay.
sometimes called the marketplace.
Yeah.
And it's basically an online platform where you can shop around for different health insurance plans.
So you can kind of compare and contrast and really see what's out there.
Exactly. You can see what's available in your area, compare the costs, see what the benefits are.
That's super helpful.
Yeah, it was a big step towards making the process a little bit more transparent and easy to navigate.
And wasn't there something in the ACA about essential health benefits? Like things that insurance plans are required to cover now?
Yes, that's right. So under the ACA, all compliant health insurance plans have to cover 10 essential health benefits categories.
Anna.
10, that's right.
Okay, what are some of those?
So these include things like emergency services,
Okay.
hospitalization, mental health care, prescription drugs.
So really kind of the core stuff that you would need.
Exactly. It's designed to ensure that people have access to basic, necessary healthcare services.
And I think a lot of people may not realize that preventative services are often fully covered under the ACA.
Right. And that's a really important point because a lot of times people put off going to the doctor
Yeah.
because they're worried about the cost. But things like your annual checkup, certain screenings, those are usually covered 100%.
So there's no excuse not to go.
Exactly. Prevention is always better than trying to deal with something once it's become a bigger problem.
Okay, now the guide also mentions these things called grandfathered plans.
Yes.
Are those kind of like vintage cars?
Kind of, yeah. So grandfathered plans are plans that were in existence before the Affordable Care Act was passed.
Okay.
So they're not required to follow all of the same rules as the ACA compliant plans.
Got it.
And so that can be good or bad depending on the specific plan.
Okay.
Sometimes they might be a little bit cheaper,
Right.
but they might not cover all of the essential health benefits,
Okay.
or they might have different rules about things like pre-existing conditions.
Got it. So it's really important to know what you're getting into if you have a grandfathered plan.
Absolutely. You want to read the fine print and make sure that it actually meets your needs.
All right, so we've talked about different types of plans, some of the key ACA changes. The guide also dives into IPAP,
Yes.
which sounds kind of scary.
It can sound intimidating.
But it's actually about protecting our privacy. Sorry.
Exactly. So HIPAA stands for the Health Insurance Portability and Accountability Act.
Okay.
And it's basically a set of rules designed to safeguard your medical information.
So it's like a bodyguard for your health record.
I like that. Yeah, it's there to protect your privacy and prevent your sensitive health information from getting into the wrong hands.
So no more gossipy nurses spilling secrets.
Ideally not.
Yeah.
I mean, HIPAA sets very strict rules about how healthcare providers can use and disclose your health information.
Okay, good. That makes me feel better.
You have the right to access your medical records. You have the right to request corrections if there are any errors.
Okay.
And you even have the right to control who can see your information.
So it puts you in the driver's seat.
It does. It gives you a lot more control over your own health information.
Okay, now on to something a bit more exciting. Cafeteria plans.
Oh,
Do we get free snacks with this one?
I wish.
I was kind of hoping.
That would be nice.
All right, so what are cafeteria plans?
So they're also sometimes called Section 125 plans, and they can be a really great way to save money on your medical expenses.
Okay, how so?
So basically, they allow you to use pre-tax dollars from your paycheck
Okay.
to pay for eligible medical expenses.
Yes.
So things like your copays, deductibles, certain prescriptions.
Okay.
Basically, you're setting aside this money before taxes are taken out.
So it's kind of like getting a discount on those expenses.
Exactly, because you're not paying taxes on the money that you're using for those medical expenses.
I like it. Okay, now the guide also talks about something called consumer-driven health plans,
Right.
or CDHPs.
Yeah, CDHPs are becoming increasingly popular.
What are they all about?
They're really about giving you more control over your healthcare spending.
Okay.
And they typically come with a high deductible health plan, or HDHP.
Okay, now that sounds a little scary. High deductible?
It can be. I mean, the idea is that you're paying lower monthly premiums, but then you have a higher deductible that you have to meet before your insurance really kicks in.
So you're paying less each month.
Yeah.
But if you do need to use your insurance, you're going to have to shell out more money up front.
Right, exactly.
Okay, so what's the catch?
Well, the idea is that it pairs really well with a tax-advantaged account, like a health savings account.
HSA.
An HSA, exactly.
Okay,
So you can put pre-tax money into an HSA to cover those deductible costs.
got it.
So you're getting a tax break on the money you're saving,
Okay.
And then you can use it to pay for those medical expenses.
So it's kind of like strategically planning for your healthcare costs
It is.
and then getting a tax break at the same time.
It's a win-win, especially if you're generally a healthy person
Right.
and you don't anticipate having a lot of medical expenses.
You can really save some money.
Yeah, you can.
Okay, so we've talked about all these different types of plans and coverage.
Yes.
Now we can't really talk about medical expenses without talking about taxes, right?
No, absolutely not. I mean, taxes are a big part of this whole equation.
So what do we need to know about taxes when it comes to medical expenses on insurance?
So the good news is that the premiums that you pay for employer-sponsored health insurance,
Okay.
those are not taxed.
Oh, okay, that's good.
That's a big perk right there.
And then I know the ACA also has some provisions for subsidies and tax credits
Yes, definitely.
to help make insurance more affordable.
Right.
So can you talk about those a little bit?
Yeah, so depending on your income and your family size, you might be eligible for subsidies or tax credits that can help lower the cost of your monthly premiums
Okay.
and even your out-of-pocket costs.
So it's really important to see if you qualify for that.
Absolutely, it can make a huge difference in terms of affordability.
Wow, we have covered a lot of ground today.
We've gone through types of coverage, essential benefits,
Ismagate, cafeteria plans, CDHPs.
tax implications.
It's a lot.
It is a lot.
Who knew that medical expense insurance could be this interesting?
Right. It's not usually the most exciting topic.
But it is important.
It is incredibly important.
And I think the main takeaway here is that knowledge is power.
Absolutely. The more you understand about your options, the better decisions you can make for yourself and your family.
So I want to leave our listeners with a few things to think about.
Okay.
First, what kind of insurance plan are you currently on? Do you even know?
Yeah, good question.
Is it a grandfathered plan?
That's important to know.
Have you explored things like HSAs and CDHPs?
They might be good options.
What are your stop loss and out-of-pocket maximum limits?
Yeah, that's crucial.
These are all important questions that you should be able to answer.
You should. And if you don't know the answers, don't be afraid to ask.
Exactly. Talk to your insurance provider, do some research online.
Mm-hmm.
Become an advocate for your own health care
Absolutely. You deserve quality health care.
and financial peace of mind.
You do.
So keep learning, keep exploring, and you'll be navigating this world like a pro in no time.
That's right.
And that's it for our deep dive today. Thanks for joining us.
Thanks for having me.